You are listening to the Health and Wellness Podcast, curated by Dr. Lori Marzell. Dr. Marzell is a primary care physician and a certified menopause practitioner that combines the wisdom of natural medicine with modern medicine to help maintain optimal health. She has a special focus in food allergies and bioidentical hormone replacement. Thank you so much for being here. Enjoy the show.
Hello, this is Dr. Marzell. Today I would like to discuss a very, very important vitamin, vitamin D. This is one of my favorite vitamins. It's really kind of a pro-hormone and not just a vitamin. But this is one of the things that would be so vitally important. If you don't want to take vitamins, this is the one you should probably take. If you're limited, I can only stand so many vitamins, take this one for Pete's sakes, and I will tell you why today. Vitamin D has the very interesting ability to be taken by different tissues in your body and converted to certain things that they would like. In other words, the function of D varies in various tissues. So, for instance, in your bones, vitamin D helps to build bones. In your brain, it helps the brain cells to be more efficient. It helps you to be less moody and irritable. It helps the brain to have better memory. And in other parts of the body, it helps your immune system to resist disease. So let's talk about vitamin D a little bit. One of my favorite charts about vitamin D information was published from the American Journal of Clinical Nutrition in 2007. It was entitled All Cancers. And what it is a chart showing if people take vitamin D, at what level their serum levels were, and what kind of cancer they would be likely to have. Was there a preventative effect on their body for these different cancers? So if you look at this chart, it starts out with a vitamin D level. And by the way, if you're doing, I think every single patient should be checked for their serum vitamin D, and the test to do is a 25-hydroxy, which is an OH, vitamin D test. On this particular chart, it goes from a level of 6, which is very, very low, to a level of 68. However, the normal range that you would be given if you looked at a lab test result would be probably up to 100. You can take too much vitamin D, and you should not take too much vitamin D. So if you are starting that, some people will bump up their vitamin D to excessive levels, which would be over 100. That can cause bone problems and liver problems and some other problems. So you should adjust your dose, recheck your serum levels, and make sure it's at a safe, appropriate level. Some people get a little carried away when they're taking things. Back to this very fascinating chart that I have kept with me in my clinic, and I send this to patients. I'm going to put it on my website as well. But this talks about different types of cancers or health problems and how what levels of vitamin D might be needed to prevent these problems. So if they look at the all cancers combined, they found that a level of, if your serum level was about 38, you would be expected to have a 35% decreased chance of getting all kinds of cancer. But if your serum level was about a 52, you would have a 75% less chance of developing all kinds of cancers. That's pretty cool. Breast cancer, you would need more vitamin D to prevent. So it goes from 50% prevention for breast cancer at a level of 50 to 67% prevention at a level of about 64 to 65. Ovarian cancer showed an increased protection from vitamin D if the levels were up to about 46 or 48 of 25%. Colon cancer can be prevented. Lymphomas could be prevented. Type 1 diabetes had an 80% chance of being prevented at a vitamin D serum level of about 52. 80%. Fractures, for 50% prevented at a level of only 34. That's very low, actually. And then you have some autoimmune disorders like multiple sclerosis for this particular compilation. And they found that you could have 66 prevention of developing multiple sclerosis if you serum level is about 56. I know you will not remember these things, but if you'd like to have a glance at this chart, and you can copy it off my website. It will be posted. You can all have a copy of your very own chart. This chart is very impressive. But if you look at it generally, what it's generally telling you is that if your serum level, if you want maximum protection against a variety of cancers, and the serum level of 68 is not excessive. If you had a serum level of around 60, you would be preventing a whole list of various cancers. Now, where I come from in Oregon, we do not have a lot of sun. And so our serum vitamin D, if we do not take any, is like, we'd be lucky, 10 to 20. I've seen the tests. I know it's very, very low. So we need more vitamin D than the California people who are out in the beach, or this Florida, out in the sunshine quite frequently. We need a lot more vitamin D. People wondered for a long time why people with autoimmune disease had more presentations of this the further away from the equator they were. And they thought this was so curious, but they found it time and time again. The farther away, the more increased autoimmune disorders were. They finally realized that it was less exposure to sun which gave people an increased serum level of vitamin D. So now that we know this, we have supplements available. One I always recommend, and remember I'm practicing in Oregon, I always recommend 5,000 units of vitamin D if you are living in Oregon. If you're down on the beach every day, you may not need that much. And I always check vitamin D serum levels with any checkup lab profile that I order. It is that important. I want to talk about a few other effects that vitamin D has. Hopefully, you will be surprised and excited about this. Now, we all know that vitamin D is extremely important for bone development. As I deal with a lot of women who are in menopause, we try to give them hormones if it's at all possible because it helps protect their bones. And it's also important to remember that they need to take vitamin D to help deposit that bone tissue and keep it strong. Let's go on. The brain effects are wonderful. They resolve irritability, anxiety, depression, and sometimes even psychosis. And the deal with vitamin D, the brain is very fragile. If you drink alcohol, it kind of damages the brain. It's in this protective milieu of kind of like a solution. Vitamin D helps protect against inflammation, which can damage brain neurons. So it's very, very important if you're worried about protecting your brain. Brains come in handy once in a while. A lot of people feel like patients who have seasonal depressive disorder, where they have to sit in front of a lamp, they just don't get enough sun, might really be a vitamin D deficiency, and I think that makes a lot of sense. Vitamin D is stored in muscles, so it helps if you have problems with muscle achiness, weakness, and stability and strength of muscles, meaning that it can help prevent falls, especially as people get older. This is why vitamin D is so extremely important in older patients. It is important in pregnancy. They found that levels less than 15 nanograms per mil in the serum resulted in a 5-time increase in preeclampsia. So it is very important. One little pill of vitamin D can prevent that. It also stimulates a variety of substances. I'm not going to tell you exactly what they are because you won't know probably. But the point being made is it's a natural antibiotic, antiviral, and antifungal substance. This is just great. I always tell people, we have COVID now. We have the winter flu. We have a pneumonia going around. It is so important, particularly in the winter, to take vitamin D every day. And it also protects your heart. Vitamin D is good for your heart. A lot of people don't know that. Some studies showed that the risk of having a heart attack was 2.5 times less for men who had a higher vitamin D level in their serum. Specifically, it needed to be above 50 nanograms per mil. That's a very reasonable rate. Again, if it is over 100, then you'd start worrying about might be a little toxic. So when we're talking about 50, we're not talking about very much. Now, some people have a hard time absorbing vitamin D, as I have noted, and I think this is the reason. Vitamin D is oil soluble, and it comes in an oil. Oils are difficult to digest and absorb, and are best absorbed if you take them with a meal. During a meal, you have a ton of enzymes and digestive juices and bile and pancreatic enzymes, and it's much easier to absorb something in an oil during a meal. I think a lot of people take this between meals, and this tiny glob of a fat in your stomach is not going to stimulate your digestive process. So always take vitamin D with a meal. I hope you got some interesting information on this very important subject. And again, if you would like to avail yourself to the fascinating chart that I spent a lot of time talking about, please check out my website, which is drmarzell.com. Very easy. And you can get it for free. Thanks again for listening.
Thank you so much for listening. If you learned something, don't forget to share with a friend. You can visit us at www.drmarzell.com. We create content for you. If there's a subject we have not discussed or a topic you want to dive deeper into, let us know how we can empower you. Questions can be submitted on our website under the podcast page. Until next time.